Hey everyone, ready for another deep dive. Today we're tackling something pretty important, chronic wounds. Those stubborn sores that just refuse to heal, especially diabetic ulcers. They can be a nightmare. Honestly, they drag on for years sometimes, making life so difficult for patients. And even practitioners get frustrated. They're always looking for better ways to help, So you've asked us to take a look at MedWave's narrow light technology, see if it really lives up to all the hype. And what I've found so far is fascinating. It uses something called Photobiomodulation, PBM for short. Sounds complicated, but basically it's using specific wavelengths of light to, encourage healing, like on a cellular level. We're talking 635 nanometers and 810 nanometers to be exact. But the thing that really caught my eye, it's completely sterile and contact free. No more messy creams or bandages. You just shine this light on the wound, 10 minutes, and that's it. Plus no risk of infection, which is a huge relief, obviously, when you're dealing with these kinds of wounds. I'm definitely intrigued, but let's get some expert insight, shall we? We've got one right here, ready to break it all down for us. So what's actually happening when we shine this light on a wound? What's the science behind it?
It's all about light, really. Harnessing its power to kind of jumpstart the body's natural healing process. See, normal wound healing, it's a complex series of steps, like a well-rehearsed play with different acts. But with chronic wounds, especially diabetic ulcers, the play gets stuck. The actors forget their lines.
So the healing just stops. That's awful.
Yeah.
I mean, think about the impact on people's lives. It's not just physical, right?
Yeah.
It affects their mobility, their work, how they feel emotionally.
Yeah, exactly. And a lot of times, traditional treatments, they just don't cut it. They're not enough to get things moving again. But that's where PBM comes in. It's like using these specific wavelengths of light, we can give those cells a little nudge, remind them of their cues, and they can get back to doing what they're supposed to, healing.
Now, you mentioned two different wavelengths being used. What's the difference? What do they each do in this healing process?
Good question. The 635 nanometer light, that's like a boost of energy for the cells, especially for producing collagen, which, as you know, is crucial for wound closure. Think of it like giving those tired actors a shot of espresso. And then the 810 nanometer light, this one goes deeper, reaches muscles, joints, even organs. It helps reduce inflammation, improves blood flow to the wound site.
Wait, organs? So it's not just working on the surface. That's amazing. It's like this technology is working on so many levels just to get the body back on track.
You got it. And the 810, it's actually being studied for other things too, like neuropathy, even gut health. But we'll save that for later. Let's stick with those stubborn wounds for now.
Okay, so this light therapy, it can help stimulate collagen production, reduce inflammation, improve blood flow. But how does it actually work on the cells themselves? I'm picturing like tiny little construction workers down there suddenly getting all this energy and motivation to get the job done.
That's a great analogy. So inside each cell, we have these little powerhouses, mitochondria. They're responsible for making ATP, which is like the cell's energy currency. And here's where PBM comes in. The light photons from PBM, they interact with this enzyme in the mitochondria called cytochrome oxidase. Don't worry about the name. Just think of it as a key that unlocks more energy production. So this stimulation boosts ATP production, gives the cells more fuel to power all those important healing processes.
So we are giving those construction workers an extra boost, making them super efficient. And because they have more energy, they can build new tissue faster, fight off infection better, and just heal that wound much quicker. It's pretty amazing.
It really is. Simple concept, complex science, but the results are what matter. And speaking of results, we have some interesting studies to talk about, both in animal models and humans. They show just how effective this technology can be.
Ooh, you've got my attention. Let's dive into that research. Let's see what kind of impact this light therapy is actually having on those really tough cases.
Okay, so you're really interested in seeing how all of this translates to real-world results for diabetic ulcers.
Absolutely. Those tough-to-heal wounds, that's what I'm interested in.
Well, there's one study I think you'll find pretty interesting. They used an 810 nanometer laser, pretty similar to what MedWave uses, to treat diabetic wounds in rats.
Rats, okay.
Yeah, no, it's not humans. But animal studies like this, they give us really valuable clues, how things might work.
That makes sense. So what'd they do with the rats?
They basically created wounds on their backs and then treated them with this laser for just 10 minutes a day for a whole week.
10 minutes, huh? Seems pretty doable, even for someone who's dealing with a chronic wound.
Yeah.
Nobody wants to be stuck at the clinic all day.
Right, exactly. And the results were impressive. The wounds that got the laser treatment, they healed way faster than the ones that didn't. They even saw like a big jump in the levels of certain proteins, like collagen, fibronectin. Those are super important for building healthy new tissue.
So we're actually seeing this light therapy speeding up the healing process, and it's promoting the growth of new tissue. That's really encouraging. For anyone struggling with these wounds, I mean.
It is. But wait, it gets better. It's not just animal studies. There have been human trials, too, with diabetic ulcers, and the findings are pretty positive.
Okay, now we're talking. Human trials. That's what really hits home. Tell me more.
All right, so there's one that comes to mind. It involved a group of people who had chronic diabetic foot ulcers, the kind that just wouldn't heal, even after 6 months of, regular treatment.
6 months. Ugh, I can't even imagine dealing with a wound for that long. That's been so frustrating.
Yeah, absolutely. Both physically and emotionally, I'm sure. But this is where the potential of PBM really shines. So in this trial, they treated the ulcers with a combo, 635 nanometer and 810 nanometer light, 3 times a week, for 4 weeks.
Okay, still a pretty short treatment time. That's good.
Yeah. And the results, well, after just 4 weeks, they saw a big reduction in the size of those ulcers. Like, on average, they shrank by about 50%.
50%? That's huge.
Right. And get this, over 60% of those patients, their wounds completely closed up by the end of the study. Remember, these are chronic wounds. They hadn't healed for months.
That's incredible. It's like PBM gave them hope again. Like, they could finally heal.
We've talked about how PBM can boost that cellular energy, stimulate collagen, reduce inflammation, all that. But I'm wondering, is there something specific about diabetic wounds that makes them, especially responsive to this kind of therapy?
Yeah, good question. Why does it seem to work so well for those particular wounds?
Well, remember how we talked about diabetic wounds getting stuck in that chronic inflammatory state?
Right.
So the constant inflammation, it's a major roadblock to healing.
Like the body's just stuck, can't move on to the next stage.
Exactly. And PBM, it's been shown to have this, powerful anti-inflammatory effect. It calms everything down, creates a much better environment for healing to actually happen. It's like hitting the reset button, basically, on the body's inflammatory response. So those natural healing processes can finally kick in.
Right. And then another issue with diabetes, of course, is poor circulation, especially in the feet. So the wound isn't getting enough oxygen, nutrients, to repair itself.
Like trying to build a house without enough materials.
Perfect analogy.
Yeah.
And guess what? PBM can actually improve blood flow to the area by promoting new blood vessel growth.
So it's clearing the traffic jam, getting those essential supplies back to the construction site. It seems like PBM is addressing, all the major roadblocks for diabetic ulcers, I mean.
Got it.
The chronic inflammation, the poor circulation, the sluggish cells, everything. It's pretty amazing, actually.
It is. And it's exciting because the research is ongoing. They're looking at new ways to optimize PBM for wound healing, combining it with other therapies, fine-tuning the wavelengths.
So this is just the beginning. So much more to learn.
Right. The potential is huge. And I think it's time we shift gears a little bit. Talk about what this looks like in a real-world setting. How are practitioners actually using this to help their patients?
Let's do it. That's a perfect segue. I want to hear how PBM is making its way from the lab to the clinic and what it means for everyone involved. So we've got the science, we've got the research. Now I want to hear about PBM in action. What does it actually look like when you're using it? I'm kind of picturing this big, expensive, high-tech equipment. Something only specialized clinics would have.
Oh, no, not at all. That's one of the best things about PBM. The devices are getting smaller, more affordable. It's becoming a real option for all kinds of healthcare providers.
So it's not just for, big hospitals or research centers.
Smaller clinics, private practices, they can all offer this.
Interesting. So paint me a picture. How does this work in a real clinic?
All right, so imagine you're a practitioner. A patient comes in, they've got a diabetic foot ulcer that just won't heal. They've tried everything. They're feeling discouraged. You want to help them, right? Give them the best care.
Of course, yeah.
So now you've got this new tool, PBM. You bring out this little portable device. It's got LEDs that emit those specific wavelengths of light, the healing ones. You position it over the wound, make sure it's all covered, turn it on. Patient relaxes for 10 minutes. That's it.
Wait, really? That's it? 10 minutes, no pain, no fuss, just light.
Pretty much. And remember, it's sterile, contact-free, so no risk of infection. And those 10-minute sessions, they can really make a difference.
I can see how this would be a game changer for both sides, really. For patients, it's non-invasive, it's drug-free, barely any side effects. They could heal faster, have less pain, maybe even avoid amputations in some cases. And for practitioners, well, it's a new tool, It could lead to better outcomes, happier patients, even make your practice more efficient.
Exactly. Faster healing means fewer visits, which frees up your time.
Plus, it's a new service you can offer. Could even increase revenue, especially with how popular these non-invasive therapies are becoming. Win-win, right?
Absolutely.
But I'm sure there's some things practitioners need to keep in mind, right? If they want to start using PBM.
Oh, for sure. It's not just about buying the device and plugging it in. You got to stay up to date on the research, the best practices.
Makes sense. Different wavelengths, different dosages, different protocols. It's not one size fits all.
Right. Every patient, every wound, it's unique. So the treatment has to be individualized. And of course, training is important. Got to make sure the technology is being used safely, effectively.
Like any tool. Got to know how to use it to get the best results. What about acceptance? In the medical community, I mean. Is there pushback against this new tech?
There's always a little hesitation with anything new, but the evidence for PBM is growing. More and more healthcare professionals are seeing the potential. It's being integrated into wound care protocols all over the place.
Like a whole new way of thinking about wound healing. Pretty exciting.
It really is. And I think we're just at the beginning. As research goes on, we'll probably see even more uses for PBM. Not just for wounds, but for other things too.
You mentioned neuropathy, even organ health. That's pretty wild.
Imagine speeding up recovery after surgery, reducing chronic pain, maybe even helping with brain function. The possibilities are pretty amazing.
It's like opening up this whole new world of healthcare,
So for our listeners who are intrigued, who want to learn more about PBM, where should they start?
There are some great organizations out there. The North American Association for Photobiomodulation Therapy, or NAILT, and the World Association, WALT. Tons of info for both practitioners and the general public.
Perfect. We'll include links in the show notes. Well, this has been quite the deep dive. We started out a little skeptical maybe, but wow, the science, the research, the real world impact, it's all really impressive. PBM could totally revolutionize wound care, and I think we're just seeing the beginning. Thanks for joining us. We'll see you next time for another deep dive into something fascinating. Until then, stay curious, everyone.